Good morning, everyone. Welcome to the European Policy Center. It's especially good to see you this day because some of you were wondering to what extent we have competition of the nice weather. But luckily, we're having this event in the morning so that perhaps indeed later this afternoon you have an opportunity to go outside as well. So welcome both of you here in the room as well as colleagues joining us online, because I think we have 40 plus colleagues also joining us online. So it's really good indeed to have you with us this morning. My name is Elizabeth Kuiper. I'm Associate Director here at the European Policy Center. And we are thrilled to have you here for this event, which will focus on open economic security in the area of critical medicines. Europe stands at a critical juncture. The COVID-19 pandemic, the Russian invasion in Ukraine, and more recently, the new realities of global trade confronted us with unwanted dependencies and highlighted how important the pharmaceutical sector is for the EU. It made us realize that health should be an integral part of the economic security agenda, impacting the EU's competitiveness, its innovation potential, and international trade. More than 2 years ago already, in an EPC policy paper about the European Health Union, my colleague Daniel Brady and I already recommended to the institutions to safeguard the EU's strategic autonomy and strengthening supply chain issues and supply chain resilience. Another recommendation from that same report was to promote access to medicines by extending joint procurement. It's good to see that this is picked up more than 2 years afterwards, because the Critical Medicines Act proposed on the 11th of March this year, just within the first 100 days of the Commission's new mandate, does exactly this, by proposing a policy framework on the nexus between industrial strategy and pharmaceutical policies. This policy dialogue, kindly supported by Viatris, a global healthcare company, will take stock of the immediate reactions to the Critical Medicines Act and explore the case for open economic security for the pharmaceutical sector. I'm confident that the discussions and exchange that we will have today will provide valuable insights and recommendations for a policy paper that we will publish after this event. These will indeed lead to these recommendations that we're very eager, of course, to share with you, and I will come back to these in my concluding remarks. We will start this event with 3 speakers that will provide opening remarks, followed by a discussion led by my colleague Paweł Świeboda, senior fellow at the European Policy Center, as well as co-director of the Brussels Economic Security Forum. And we're very honored to have with us 3 really high-level speakers that have been involved very closely, especially, I think, the first speaker, Lorena Alonso, the Deputy Director of DG Health from the European Commission. Your Director General has been very, very closely involved. So it's a pleasure to have you, as well as your colleague, who I think has been almost literally been writing the Critical Medicines Act with us this morning. So I would like to give you the floor to indeed provide your opening remarks and your perspective on the Critical Medicines Act. Thank you very much for being with us.
Thank you very much, Elizabeth, and thank you for you're bigger than me. Thank you to the European Policy Center for organizing this event. Very timely indeed, because it is indeed very important to tackle something which is already a long-standing concern in the European Union, which is the shortages of medicines. And in particular, those that are critical, the critical medicines, because, as you know, those that could create a serious harm to patients if we have insufficient supply, and for which there is not a suitable alternative. So the impact of a shortage in those can be really dramatic. So this is why, indeed, you're right to put the Critical Medicines Act in the context of delivering health security. And this, as I was saying, is something that is not new. You may remember in the winter between 2022 and 2023, when there was this big peak in respiratory infections, and we had severe shortages of antibiotics. This had an impact basically in almost all member states. And still today, the community of pharmacists spend around 11 hours every week only to deal with, to manage shortages and to seek for alternatives when there are medicines that they cannot supply. Then there is another issue that we are covering as well, because we call it the Critical Medicines Act, but I'm sure during the debate, this will be better explained. We are covering also the type of medicines that we are calling of common interest, for which there is also a chronic problem, and that are those such as for rare diseases or novel antimicrobials, where we see that they cannot reach patients in all member states simply because they are not even marketed. So why do we have these shortages? I think that we need to, if we want to tackle the problem, we need to start there. And it is a complex issue. The root causes are not just, they cannot be pointed that this is just the only reason. It's complex. On the one hand, we have problems, I would say, in every link in the pharmaceutical chain. For example, of the 50% of the reported shortages are caused by manufacturing issues. What could this be? Capacity constraints, delays in manufacturing, and of course, the unavailability of active pharmaceutical ingredients that are absolutely needed to produce medicines. Of course, in the current situation, with the tensions we have, the competition for resources is leading to the concentration of the production in only a few countries that are outside the European Union. And this is making us dependent in a way that certainly is not very smart and absolutely not sustainable. This is particularly the case for generics, where the EU is heavily dependent on non-EU manufacturers that are in India, in China, which both account for around 75% of the global production of APIs. So when we have this situation and there is a sudden surge in demand, then the supply chains are very, very vulnerable to disruptions. And this surge in demand can come from something, well, big and dramatic as was the COVID-19 pandemic, but it can come also by a simple change of clinical guidelines in a country. For example, national vaccination programs. Suddenly it changes and you have an unexpected higher demand of some vaccines. So something also to point, and I hope it will be covered in the debate later on, is that you see, of course, a great variety of the situations depending on the member state you are in concerning access, and this can be influenced by the size of the market or sometimes of how products are used. This is the case, for example, for orphan medicines or novel antimicrobials. Now, this is a big issue. How are we tackling it? Certainly not only with the Critical Medicines Act. This is an issue that can be seen from many angles. Let me mention to you those on which we are working in DG SANTE, or together with the colleagues like from HERA, for example. One of the tools we are using is the reform of the pharmaceutical package. You know, currently in the hands of the Parliament and the Council, but here you see a number of provisions that are there to tackle this matter. For example, the fact that pharmaceutical companies will need to notify earlier when they face a shortage or when they identify risk in the supply chain, or to put measures in place to avoid the shortages. Same when it comes to the expansion of the mandate of the European Medicines Agency to mitigate or manage structural medicine shortages, I would say. Now, this is a tool that is very important, but this tool is designed to deal with shortages as they happen, like ongoing shortages, or to prevent them from happening. But this tool, which is very important, is not designed to tackle the root cause of the problem. This is what we were missing. For this type of problems, if what you want is to tackle the origin, you need an industrial policy tool. And this is in a way what the critical medicines is an industrial policy measure that is trying to build resilient supply chains in the mid and long term, to try to fix the problem at the source. At the same time, and precisely because this is an industrial policy for the long term, this is complementary also to other tools that are, for example, more there to deal with crisis management. For example, some critical medicines like antibiotics may be very important in, let's imagine, even a military context, but the Critical Medicines Act is there to ensure stable and sufficient supply at all times. But it's complementary, as I was saying, to other type of tool, like, for example, the rescue stockpile of key medicines or countermeasures to chemical, biological, radiological, and nuclear for CBRN threats. And it's also complementary to joint procurement agreement, which is conceived for procuring medical countermeasures against cross-border health threats, like, for example, vaccines. And I can say that, for example, the colleagues from HERA just signed a joint procurement for 27 million doses of pandemic flu vaccine. So these are complementary measures that are more for this type of situations. Now, the Critical Medicines Act, as I'm saying, is also contributing to the Union's overall security, but more as a structural measure, in particular when it comes to investment to enhance manufacturing capacity. Now, how is it working? I'm not going to go into the details of the Critical Medicines Act because I'm sure all of you have read it carefully, and I'm sure the debate will go into that. Just to mention that we have, as I was saying, some of the measures are more directed at the supply side, and these are those measures that have as objective to strengthen manufacturing capacity, and they are designed by facilitating investments for companies that want to create, to expand, or even to modernize manufacturing capacity within the European Union. Okay? I'm sure you will go more into the details within the European Union. We do it by identifying strategic projects and a number of stated guidelines that were adopted at the same time. Important, the companies benefiting from financial support for a strategic project will be obliged to ensure EU supply. So this is how the mechanism works. Then, as you know, and I'm sure you will be discussing this later on, we have some measures that are more on the demand side. Here you have whether at national level for national procurement, where I would say one of the main things is not to focus only on price, and also among member states, and you were mentioning it, through collaborative procurement, by creating a bigger demand by joining the demand of several member states. Very important, and I'm sure you deal with it, the international angle. EU, but of course, we will need also to strengthen cooperation with countries and explore new international partnerships. It's necessary with like-minded countries to reduce dependencies. I mean, the European Union is big in exports of medicine, of medicinal pharmaceutical products, and honestly, we want to keep it that way. We want to keep the European Union being a big exporter. EU exports have grown by 148% over the last 10 years. And again, we want this to continue. And for that, we need also to expand our manufacturing capacity. So let me just conclude, because I know I only have 10 minutes or even less, by saying that there is a provision that probably is not the most sexy one, but I think it's extremely important, which is the member state coordination group. And I insist on that because, as I was saying before, the situations might be very different depending on the member state, and that there is a coordination among them is extremely important. So this group, or whatever comes out of the negotiation, we really need a mechanism of having member states around the table, exchanging information, exchanging strategic guidance, and avoiding, for example, situations where financial support would be concentrated in one area of the critical medicines, and then it would be lacking in other therapeutic areas. So this mechanism is really, really important. And I'm going to leave it there. I really hope that you have a nice debate. I'm going to stay now for the other two speakers. But thank you again. I think, as I was saying, that in the context we are, these type of debates are really necessary, and we'll be looking forward to read your paper. Thank you very much.
Many thanks, Lorena, for these opening remarks. I think you touched on quite a few important issues also for the debate that we're going to have later on. I think especially what you said, that of course this is not only big for Digital Santé, as you put it, but also it really in collaboration with other DGs, and we have your trade colleagues as well with us. So I'm sure indeed that we also will touch on that angle later on, as well as the more international context that you mentioned as well. So many thanks for these opening remarks. We now go to our two other speakers that will join us online. I believe that we have already online Francesca Colombo, the head of the health division from the OECD. Yes, Francesca, I see you online. I hope, Nida, that you also can hear and see us well.
I can.
Super. Well, Francesca, it's good to have you with us because you're a trusted advisor who has been working with us for a long time, and amongst other things on issues to do indeed with access to medicines, but also, of course, the outstanding data that you always have. And I think that provides a really important angle to this debate as well, especially indeed if we want to touch on this broader context, but also I think the work that the OECD has been doing in the context of the pandemic, the COVID-19 pandemic. And I think especially linking that to the resilience of healthcare systems, I think you have a lot to share with us probably. So we're looking forward to your opening remarks as well. Thank you very much for being with us.
Thank you so much, Elizabeth, and apologies I cannot be in person with you, but some of the remarks I'm making will resonate very much with what we just heard from Lorena. First of all, obviously, this dialogue is very much welcome, and it's welcome not just in the context of what we lived through COVID-19 and the very important issues of making sure that we have resilience in medical supply chains and more broadly in health system, but because the security of medical supply chains actually has implications for the health of individuals and resilience of the health system. And it's something that pre-existed COVID-19. I mean, we have done some work at the OECD that looked, for example, at shortages. That was done way before COVID-19. And it shows that shortage notifications across countries had increased by 60% in the space of 2 years between 2017 and 2019. So quite clearly, the issues of security of medical supply chains is not something which is relevant just in the context of a crisis, but it needs to be part more of the routine policy responses that we put in place. And as it was already mentioned, the causes are different. And I think we need to think of perhaps of a package of interventions done nationally, done internationally to address those root causes, because they do span from issues which are exogenous, linked, for example, to manufacturing quality issues that in our previous work were about 50 to 60% of all the medical disruptions in supply chains, but also issues related to pressure on prices in some contexts that might actually make certain products not being remunerative enough or profitable enough to be produced. Obviously, surges in demand that can be sometimes unexpected, and tensions on raw materials and active ingredients. So multiple and complex causes that will require a package of different approaches, and so not just what can be done perhaps through this specific act, but more specifically through a variety of different policy interventions. It's important also to say that this is not just a European problem. It needs to be placed in a discussion that we have here in a broader, also global international context. And from this perspective, just as a second thought that I wanted to have, it's important to realize that medical supply chains have been increasingly internationalized over time. And this has been well analyzed in a report that we produced actually in 2024 on the security of medical supply chains in the post-pandemic world, that was realized thanks to the leadership also and support from Belgium, that I would like to very much acknowledge. Has been really very much pushing OECD to do work in these areas and also help us to have discussion at the high-level events that we hosted at that time. Through some of the analysis that we've done there, I've pointed to how in the past 30 years, trade in pharmaceuticals has actually been multiplying by a factor of 10. And this concerns not just the movements of goods, but also the intermediate inputs. So when we're talking about an incredibly internationalized context for medical supply chains, it's quite clear that the solutions needs to come not just from a domestic response, but the importance of international cooperation and coordination is critical in this respect. And I think that's I would like to reiterate what was already said of the crucial role that the critical medical coordination group will have in this context, but also the importance of linking this to more global discussions. I mean, we're talking about security supply chains. It's not just a European conversations. There are discussions which are happening in the context of the G20, for example, under the Brazil presidency of the G20, a critical alliance for local and regional production innovations and equitable access of medicines and vaccines in particular was created. More broadly, there are conversations about how to make sure that in context, for example, of crisis, we can ensure that there is enough domestic production and also distribution, fair allocation and distribution of the products. So this to say that addressing these issues require very much that willingness to work collaboratively between governments and the public sector across different governments within Europe, but also more globally and broadly. The third point that I wanted to make is that addressing the challenges does require multiple solutions, and those needs to be taken into consideration both in context of routine as well as the context of emergencies and crises. And I would like to reiterate the importance of the routine issues. I mean, medical supply chains disruptions, as I mentioned, pre-exist the COVID-19. They're not just something which are triggered by a health crisis. And so we need to act on several aspects. One of the things that we made very clear in our work that we have done on that publication that I mentioned before is the importance also of financing the visibility of the whole medical supply chains. Actually, in order to anticipate the risk of shortages, we need to do something to make sure that there is less opaque understanding of the structural medical supply chains. We lack a lot of critical data. And I think from that perspective, there was discussion in the context of the Critical Medical Alliance about creating a sort of platform for assessing the vulnerability of medicines. I think we need to have just more data in order to understand what's the root causes and what's also the impact of policies which are put in place. And when we're talking about mitigating those root causes, I think the act that the discussion will focus on today has important aspects related to increasing the supply chain security, for example, looking at selection criteria on including supply security and not just prices. Those are very important issues. But again, to remind that issues related to quality management and standards are also important determinants of supply chain disruptions. There are also opportunities when we're looking at solutions like in relation to procurement and pool procurement, again, to learn from what has happened beyond Europe. Paweł, for example, has quite a long-standing experience in terms of managing pool procurement. So again, the importance of looking beyond Europe. I'll stop here for the moment, but yes, my main message, as I said, is the importance of international cooperations and going beyond just the Europe context, the need for multiple policy responses and tools, because the medical supply chains disruptions have very complex root causes. Thank you very much for the opportunity, and looking very much for the discussions that will follow.
Thanks, Francesca. I think there was a lot of food for thought for the discussion later on, indeed, in your opening remarks. I think you pointed to the fact that, indeed, supply issues are not just a European problem. I think pointing out that trade had multiplied by a factor 10, which I think is especially important to mention in the current point in time, where indeed we see that we need to redefine openness and with which part of the world we do trade, and then how that translates to indeed potential disruption of our supply chain. So I think all of this was very important, and I've already been making a lot of notes. So many thanks, Francesca. And I would be very happy indeed to follow up with you and perhaps provide you with some policy recommendations afterwards to you. So many thanks, and hope to see you next time. Our next speaker, whom I believe is also with us online and also should be waiting already, is Natasha Azzopardi-Muscat. Yes, Natasha, I see you. You are the director of the Division of Country Health Policies and Systems at WHO Europe. We're delighted to have you with us because you may have been listening into previous speakers, Lorena Boix, who represented the perspective of the Commission and pointed indeed to also how for the Commission, this is a really important issue where the Commission is teaming up, of course, internally as well as externally, given the fact that this is not just a health issue, but also very much on the nexus between health policies and other areas. You may have heard Francesca, who also indeed from an international perspective came in. And I believe that also you from a WHO perspective are very well placed to indeed let us know and assess how you will see the role of the Critical Medicines Act, also in the context of the work that you have been doing yourself with the world within the World Health Organization. So Natasha, it's great to have you with us, and I give you the floor.
Good morning, Elizabeth. Thank you very much for this invitation, and I hope that you can see and hear me well. Indeed, I have been listening carefully, and I would like to congratulate you for putting this important event together today to discuss the availability and security of critical medicines. And indeed, I speak on behalf of the WHO Regional Office for Europe, which covers around 1 billion people, 53 countries, or the EU countries, and then moving also into the eastern part of the region, the Caucasus and Central Asia. And let me start also by saluting Lorena and acknowledging the work of the European Commission, specifically DG SANTE in this area, as this has been vital for securing the safety, availability, and accessibility of medical products for EU citizens. And we believe with its recent proposal for a Critical Medicines Act, the Commission is taking an active approach to address what is a growing problem of medicines shortages, and which presents a clear risk to both public health and to health security. And we support the vision for a more autonomous, resilient, and coordinated European landscape for critical medicine. This is timely and is very much needed. So on behalf of WHO Europe and our regional director, Dr. Hans Kluge, I would like to underscore our full support for the goals underpinning the Critical Medicines Act, and also to acknowledge the leadership of the Belgian presidency in putting this on the agenda. We believe that the Act does respond directly to the vulnerabilities we witnessed so starkly during the COVID-19 pandemic, including shortages of vital medicines, over-reliance on limited suppliers, and gaps in supply chain transparency. So these are not theoretical risks. They are real risks to patient safety, to health equity, and to our health system. Secondly, I would like to commend the focus of the Act on supply chain strengthening, on the collaborative approach, on strategic stockpiling, and enhanced regional production capacity. These are, of course, essential pillars of a more secure and sustainable pharmaceutical ecosystem, one that can withstand shocks and serve populations consistently, such that we continue to ensure that people and professionals place trust in the health system and in the institutions. Beyond facilitating the new and enhanced modalities for procurement and stockpiling, with which we agree, and we believe that these need to be solved at a regional perspective rather than reliance purely at national level, particularly when considering also the diversity that exists among member states in the European Union. And here it's going to be crucial to invest and support pharmaceutical manufacturing and the policies and incentives for ensuring local and regional manufacturing of both the APIs and the finished products should be promoted, as the efforts on procurement and stockpiling will not be able to stand alone. And we believe that these efforts need always to be built on a foundation of strong national regulatory agencies, because we must continue to promote an emphasis not just on the production, but on the production of quality assured products across the region. And now allow me to mention a couple of notes of caution. As policymakers, I'm certain that you are very well aware that legislation, no matter how well intended, must be implemented wisely. In this sense, as WHO, we would like to urge that the Act be clearly grounded in 3 principles. The first will come as no surprise: solidarity beyond borders. European self-sufficiency must not come at the expense of global health equity. As already rightly emphasized, the European Union's approach must remain outward-looking, and WHO Europe stands ready to act as a facilitator, mediator, broker, to build cooperation and strategic partnership, both with accession and with neighborhood countries. And allow me here also to commend the European Commission for playing an active role in enabling us to be able to make progress and reach a milestone when it comes also to the pandemic treaty, a very important milestone that was reached a few days ago. And I know that the European Commission has played a very important role, as well as all EU member states. The second point that we would like to highlight is evidence-based prioritization. In this sense, the definition of critical medicines must be transparent, dynamic, not set in stone, and inclusive of public health needs across all the countries, not only those with strong purchasing power, if I may be allowed to say so. And the third is the policy coherence. In this sense, we must ensure that the Critical Medicines Act complements and aligns with existing EU and WHO frameworks on medicines access and health security, as we would not wish duplication of efforts to weaken our collective impact. Having sounded these notes of caution, I still say that we see enormous opportunities in this Act, and we would like to support its implementation, and we believe that we are well positioned to do so. How? Our regulatory networks can assist with aligning standards and reducing barriers across jurisdictions. Our technical support can help bolster manufacturing and distribution capacities, especially in underserved parts of the region. And thirdly, our focus beyond the border of the EU will also ultimately strengthen the impact inside the EU itself and potentially assist in developing new regional hubs for manufacturing, reducing the reliance on the current limited suppliers. And here, let me make reference also to the high-level summit that was conducted recently also between the EU and heads in Central Asia as an example. More importantly, let me continue to reiterate and close by reiterating that as WHO Europe, we are committed to being a partner for the European Commission in supporting member states. We acknowledge that the road ahead is not without its complexity, but is also rich in possibility if we align our strategies and maintain our shared commitment. So in closing, I invite us all to view the Critical Medicines Act not merely as a regulatory tool, but as an opportunity to strengthen public health, to strengthen health systems, to strengthen health security in our region. So let us seize this moment to strengthen a system where every citizen in every corner of our region can rely on both availability and accessibility to the medicines they need, not only with a focus on times of crisis, but every day. Back to you, dear Elizabeth, and thank you so much for inviting WHO Europe to be part of this important debate.
Many thanks, Natasha, for these very important opening remarks, and also for bringing in, indeed, the global health equity context. For years, we may have been taking this for granted, but especially in the current context, it is important indeed that we keep that very high on the agenda, as well as you said, evidence-based policy making. I think that also resonated with what Francesca Colombo from the OECD already brought in before, the importance of transparency and data, as well as policy coherence. And I think especially the fact that in our discussion in the panel, which is going to be followed now, we will touch on that as well, on indeed a more holistic vision on the importance of critical medicine in the broader political context. I think that was very important. So many thanks, Natasha, for being with us, and hope to keep in touch. Well, as I alluded to, I think we already have a lot of food for thought and an input for the panel discussion that we're going to have now. So I'm going to leave you in the very capable hands of my colleague Paweł Świeboda, because Paweł and I have been working on health security for, I think, more than 2 years now. So this for us is a really continuous discussion in that context. So Paweł, I leave it to you to announce our panel, but I'm looking forward to the exchange.
Thank you so much, Elizabeth, and huge thanks to our opening speakers for extremely inspiring remarks. We now have close to 1.5 hours to discuss in depth the Critical Medicines Act, its objectives, its rationale, but also its future implementation. How do we make the most out of it? What I would like to propose is that we have as interactive discussion as possible. We will still be sitting on the stage and you will still be sitting in the audience, but please signal to me if you want to intervene, agree with something enthusiastically, disagree vehemently, have a comment or a question. And the same applies to our online audience. I have in front of me a tablet with an overview of questions. So we have close to 60 participants online. Please ask your questions and I'll come to you shortly. I will ask your question. That's how it will work. So with that in mind, I would like to introduce a truly stellar panel consisting of people who have both worked on these issues day and night over the past years, those who are involved on the industry side, and those who look more at the international dimension, which is extremely important. So in the order that I will call on you to intervene, I would like to invite to the stage Bruno Gautrais, who is head of unit for medical products Quality, Safety and Innovation at DG Health. Warm welcome. Gloria, Ghéquière, I think Belgium and the Belgian presidency, I counted about 3 times that the references were made in the opening remarks. And of course, Gloria was the driver behind these efforts during the Belgian presidency and beyond. She's currently deputy head of cabinet of the Federal Minister of Health in Belgium. Thibaut, Senior Director at AmCham. Enrico Baraldi, Chair of Marketing at the University of Uppsala. And last but certainly not least, Elena Kamilarova-Alomar, who is Policy Officer for Technology and Security and at DG Trade. Very good. So with that in mind, I would like to go first to Bruno. And please feel free also to refer, expand, or comment on anything you have heard in the opening remarks. I leave it entirely up to you. And you can speak from here, you can come up here as you wish. Bruno, I would like to ask you, because you are the one who at the Commission literally spent days and nights on the Critical Medicines Act. You can tell us more about that as well in the anecdotal dimension. But what I would like to ask you is, how do you see the implementation of the Act being run, given that it needs to sort of fire all the 3 engines that we've heard about from Lorena, Alonso at the beginning. So first of all, manufacturing capacity, secondly, the demand measures, and in international partnerships on which a lot of stress has been made. So how do you see the balance between those 3 important action areas being achieved?
Thank you, Paweł, giving me the floor. Yes, a lot has been said already by Lorena, but obviously this has been a very common effort also inside the Commission. As you realize that even if we work for patients, ultimately, there are many aspects which are not, let's say, fully under health remit. Some trade dimensions, some state aid dimensions, and this again was a collaborative effort also inside the Commission. And how it will work in the future, hopefully soon, because that's treated as an urgency by the Commission, will be also a collaborative effort. I would say, again, with the existing bodies or let's say entities of the Commission and institutions, but also with stakeholders. That means the industry, other stakeholders, member states obviously will have a role to play and to coordinate all these actions which are made possible through the Act will certainly be key. And that's why there will be, and Lorena mentioned it, this coordination group among member states to really prioritize, to try to not duplicate, and to focus the efforts where they are really needed. And as you realize, and that may come in the discussion, let's say the budgetary aspects or angle or money issues will remain. And it's not that we are in a situation where we can just produce and invent money. We have to live with the existing constraints. And there is, again, even more a need for good coordination. When it comes to international partnerships, and here also how to prioritize, how to decide which like-minded countries we want to cooperate with, that's also something which needs to be coordinated. There are existing cooperations with member states, individual member states, but to make it a European, let's say, endeavor and approach, that will also be dealt with by this coordination group. So it's a toolbox, the Act. There are many ways to, let's say, improve the supply situation. But indeed, the challenge will be to finally produce a good and well-balanced text, which is really useful to the actors and make it work in the future with the existing constraints.
Brilliant. Thank you very much. Now I'm testing my microphone. Yes, very good. I'm already looking at the room if there are any immediate question. I think what Lorena stressed in her introduction is also super important, namely that all the measures that had come before had to do with more sort of incidental situations, while the act is more looking at the long term. It's looking at the systemic issues. It's looking at the industrial policy aspects, right? So that's an important distinction, because very often one could get the impression that it's yet another approach, which is not necessarily making the landscape clearer. There is another body that is being created, but the distinction holds, right, between what needs to happen now on the spot when a crisis situation arises and what builds the long-term capacity.
Very briefly on this, indeed, there have been tools developed as a consequence mainly of the COVID, but there were reflections before that with some bodies, the MSSG, the SPOC, and the work with the agency in crisis times. Then the pharma reform currently being negotiated is more for, I would say, all times or peace times, but addressing indeed, as you say, the monitoring, the, let's say, correction or management of actual shortages and trying to anticipate them. But here we are addressing more long-term and structural issues. And again, with a need to tackle it at EU level and no more at national level.
Brilliant. Thank you so much. So, Gloria, I would like to ask you more specifically about the pain points that this initiative tries to address. So there are the root causes that the Critical Medicines Act aims to solve. And there was this dedicated project under EU for Health that examined in great detail and surveyed member states, companies, arriving at the conclusion that 50% are manufacturing issues. And I think Lorena sort of disentangled that a little bit for us, what that means, but grateful if you could go into more detail as well, how you see it. There are other issues in the other 50% that need to be taken into account. There are distribution issues, for example. There are issues that have to do with commercial aspects. So that's the pricing question. And I see that Francesca is still online, and what she told us earlier about the OECD work on the risk on the root causes is very valid, because as she stressed, the problem did not resurface only during the pandemic. It was already there earlier. So the 60% notification, this is 60% rise in shortage notifications prior to the pandemic was already there. So how would you see the root causes of the problem, and is the Critical Medicines Act, the right toolbox to address them?
Thank you. I think there are two problems that need to be addressed. First, there's a structural problem that we have with shortages, and indeed, you rightly mentioned that many of the shortages are due to manufacturing issues. But honestly, I mean, we've had this task force on solving shortages at the Belgian level for a pretty long time now. And root causes still remain, I would say, pretty opaque. You never get the right information, I would say. Sometimes there's a quality control issue. This has caused a huge issue with thrombolytics, for instance. Sometimes you have the war in Ukraine, and then it's a packaging issue. Sometimes it's really the API that's not being delivered. It can be many things. And so there, I would say one of the very good things about the Critical Medicines Act as it is proposed is that it tries to create a more sustainable market. So we will work on the procurement scheme. Member states are encouraged to create national programs, which we in Belgium are now setting up to do. So I'm working on this. I mean, don't ask me if you're from the press, because we are still reflecting. but certainly in the next budget in Belgium, we will try to create measures for a more sustainable generics manufacturing market. Another problem is that we are really living in an unsafe world with many crises. It can be a climate disaster, it can be a pandemic, but it can also be a war. And it made me reflect on the international partnership issues, right? Because I love international partnerships, but honestly, at this point, an international partnership with the US, for instance, is not my priority anymore. So we are living in sorry. And I would love an international partnership with many of our neighbors, but they need production capacity and know-how, so it's all not super easy. It's not easy in the EU, it's not easy abroad. So we are living in a world that is unsafe. And I know that I used to work on international trade, so the international trade people will say you cannot manufacture everything yourself, and they are extremely right. But let's try to manufacture as much as possible, I would say, because it can be really valuable to have this technology, this know-how, the production facilities on your own territory. I think, and there, the Critical Medicines Act, of course, and there I would say that the Act definitely needs strengthening. So another good point is, of course, the coordination between the member states. It would be valuable to also have more of an idea of what we want. I think the union list of critical medicines here is leading, so it's very useful. It would be useful to have more analysis of our wish list, let's say, and but it's the money. I mean, it's really the money foreseen at the EU level is not adequate. I know that the proposal gives access to STEP, but the problem is always the same. The money at the EU level was designated for innovative products. Always. If you're talking about clean technologies, green technologies, it's innovative. If we're talking about semiconductors, I mean, the Commission had a huge discussion at the time whether to support the old semiconductors or the new ones. I mean, we are supporting the new ones. And so now you give the critical medicines access to STEP, but we are dealing with a different beast. And it requires, I think, a type of funding which has different governance rules. And this is also true at the national level. During the pandemic, we did launch an IPCEI, an IPK, to strengthen our domestic manufacturing of critical technologies and ingredients. It didn't work very well. So one thing that, for instance, would be very practical is if the Commission could come forward with a new communication on the IPK, which has new rules, new conditions, which are tailored to the industry. So that's definitely, I would say, the weak point.
Thank you very much, Gloria, for all the points. Maybe on the money question, I'll go back to Bruno immediately, not to put you on the spot regarding the very concrete recommendation we just heard from Gloria. But I mean, if you could tell us more about how you see the current funding landscape for CMA-related activities, and then what else can be done in the future.
Obviously, that as you say, Gloria, the situation has evolved and changed, and the money which was allocated in current programs was maybe not foreseen for these challenges on critical and generic medicines. We have to be pragmatic and also live with, again, the constraints we have with the current EU funding. So the Act tries to channel or to direct the current funds available towards more, let's say, secure supply of critical medicines through state aid, through procurement criteria, and so on, giving access to facilitated, let's say, procedures, but indeed money, tapping in the cohesion funds, for example, but this is limited money. Also at national level, I mean, there are other priorities. Let's also be realistic when you see the security situation, the defense situation. Obviously, some money will be channeled there that cannot go elsewhere. And then we have the new MFF coming, starting 28. where with a competitiveness fund, with other funding mechanisms, there will be room first for a proposal, then for negotiations, obviously. And there, I think that's where the real discussion will take place. So it will start very soon. It will not bear fruits maybe immediately. So we have for, let's say, 2 years to live, 26, 27, to live with the existing, be clever, prioritize. And again, the coordination will be key there.
Absolutely.
Because I'm not a great diplomat, but it's interesting because, of course, we are talking about security and defense. And I think we should definitely strengthen our defense capacity. But if you ask me, like, let's say actors like China and Russia, right? So Russia waged a terrible war against Ukraine. And the Ukrainian war army was not fully effective, but relatively effective. I mean, they know that they cannot stand up against the French army or a Spanish army. So what do these actors do first? Is try to undermine you, to destabilize you. And that's why I think the medicine supply is a security issue too. And it should not be forgotten in the defense story. And it should not be forgotten in the funding. It would be a stupid, stupid mistake to make.
Yes, thank you so much for making that point. We have one question that I would like to bring already from the online audience, namely, what will be the difference between a critical medicine and an essential medicine? Will the EU list conflict with national lists? That's the question. Bruno, if maybe you could tackle that, and then we go to Thibaut. We widen the discussion to the international and supply chain context.
In the Act, we try to not overcomplicate the situation or duplicate or add burden to burden. So let's be clear about that, meaning we will build on the vulnerability evaluation, which is foreseen through the pharma reform, and hopefully will be concluded as soon as possible this year. And that's so essential or critical. There is a definition of critical medicines. It builds on the national lists, and here the core of the discussion in Council at the moment is indeed how broad we should be with this list. We, in the Commission proposal, wanted some shortage prevention plans for all molecules, meaning indeed a very broad scope. And this will be the way you get the information, or you make mandatory the providing information to make your system work and be able to analyze where the supply chain vulnerabilities take place, how to correct them, and how to prioritize them. So again, there are the tools. We will use what we already proposed and not do anything different. But of course, it's another layer of data to provide and another kind of analysis, but still with the same data, with the same tools, and a central role of the MSSG. So a mix of the agency plus the member states, also with the presence of the Commission, to decide on what should be on the list, giving access to these, let's say, various funding mechanisms.
Great, thank you so much. Oh, we have 2 questions here in the room already. Thibaut, can I ask you for your patience and other speakers, of course, and because I assume these are on this very question. So let's borrow the mic here and let's take both of these questions and then we continue the discussion.
Hi, thank you. My name is Rafał Ramotowski. I'm representing Plasma Protein Therapeutics Association. And I have the question regarding the critical medicines list, because the Act itself is developed to cover all medicines from the critical medicines list. But in the end, when we look, for example, into collaborative procurement procedures, it's quite difficult to imagine that 270 medicines could be procured in this way. Will there some special measure apart from those enlisted in the Act, so vulnerability assessment, etc.? is Commission going to use collaborative procurement procedures like joint procurement, for example, only in case of emergency, or how Commission will approach this topic, how Commission will select these medicines? Because, you know, it's an open door, but we don't know how often people will go through this door, and this is essential for the industry. Thank you.
Thank you so much. And let's take the second question right away, which is right in the middle.
Thank you very much. My name is Elaine Cruikshanks from AmCham Public Affairs. My question was about the definitions, because you said there's a definition of critical medicines, but what about medicines of common interest? How is that going to work in terms of the Act? And what does that mean in terms of predictability for the industry and other players?
So thank you for the questions. And indeed, that will be also part of the discussions, obviously, with the co-legislators, because some, let's say, principles have been put in the proposal that need to be developed in practice. And when it comes to procurement and indeed giving access to joint procurement, for example, you want to focus on the very essential where you have identified very critical supply issues. And that's why, as you see in the text, there are, let's say, different levels of cooperation, different level of support by the Commission, going up to joint procurement. So I would say that's to be defined. The criteria will need to be worked out, but it's indeed something which will become very rapidly a key question. As regards the products of common interest, that's really, it's no more the critical medicines, if I may say, but it's really, and that was also, let's say, a clear intention of the Commission, and especially our Commissioner, is for products for which the market is not, or the internal market is not working as it should. So where there is a kind of a failure, a market failure, to allow access for some smaller member states or with low purchasing power to have access to some medicine that would not be accessible because of a commercial choice or because the market is, let's say, too limited. So it's really to correct the access part, playing on the demand side and trying to group the purchasing powers to make it, let's say, accessible also to these member states. So that's another category of products, but indeed very important. And as I said, it's a toolbox. And here we thought it would be interesting to have also this possibility also in the Act.
Thank you so much. And now, Thibaut, I would like to ask you about the supply chain and international context, given the work that you have done at AmCham, including in the position paper published last October, which was dedicated to ensuring resilience of life science supply chains. And there you called for a balanced and multidimensional approach with respect to that issue. And you also said that policies must encourage diversified global supply chains, regulatory flexibility, and competitive procurement practices. Now, do you see what we find in the CMA proposal? Do you see these principles being properly reflected?
Oh, thanks. And maybe just for background, AmCham, you represent American companies in Europe. We're a nonpartisan organization, and US FDI is the largest source of FDI in Europe. And so when you look at life sciences specifically, I think that says a lot about the commitment of a lot of our member companies to basically meeting the goals that have been set out by the Commission when it comes to addressing some of those vulnerabilities. I think it's always important in those conversations to bring it back to how do we ultimately reconcile some of the business realities with the policy objectives, and how do we make sure that those can actually live together? And I think what led to the Act, which was the alliance, was critical because you needed that dialogue to take place, right? And so when you think about our companies that are operating globally, you think about those supply chains that have been built over the years and are really, really complex because of the sourcing of inputs, of some of the goods, of the manufacturing equipment, and how that has been built over the years. And so that is a fact of, and I think that was brought up by the speaker from the OECD as well, in terms of how today's supply chains are organized. And so to us, indeed, if you start from an assumption and you realize, and I think you made that point as well, that basically no country can produce all of the medicines it requires, and that no medicine can be produced in every single country, then you need to be thinking about how you address that. And indeed, to us, diversification is the key. And I think that's recognized clearly in the Act in terms of international partnerships. I think what will be interesting maybe to discuss in this session is, what do we really mean with international partnerships? To me, and I'd love to hear from Elena on this, I'm thinking also trade facilitation. What are some of the measures we put in place to ensure indeed that those international partnerships take place? Because ultimately supply chains aren't powered by governments, they're powered by business. And so, how do you kind of think about indeed the conversation that takes place at government level, but how do you bring in the business dimension, and how do you make sure ultimately you make it easier for medicines, for some of the inputs to get where they need to go? To me, that's critical. 2 points maybe on, as we look at the acts of what we think is supportive and what we think it's important to continue the conversation. Maybe one, there's a trend around the world around localization of production, or this idea that would make people safer. And I don't think it's a European thing. You're alluding to the US, and I think we can look at other parts of the world where that's a trend as part of the conversation. As global companies, we don't think that's actually going to help with the objectives we're trying to achieve. And so you see in the Act on the proposals around procurement, for example, this idea that you would need to localize production, and that would basically solve issues around vulnerabilities. I think there's some doubts in the business community about how you're going to get there, just because when you think about the complexity of the sourcing of just the inputs, for example, realistically, even if you have, your nice manufacturing site in Europe somewhere, it doesn't necessarily mean that you're not exposed to any vulnerabilities anymore. And so to us, spending time on actually the diversification factor on how those supply chains are integrated would probably be kind of best used. I think that's one element. Another thing I think that the Act does quite well is recognizing, and that's been mentioned, the structural challenges that we're facing, thinking about potentially some of the incentives that can be provided with the stated guidelines, but also strategic projects. To me, I think what's important is, how do you broaden the scope to what industrial policy is, which can be incentives, but it's much wider. And ultimately, if you put yourself in the shoes of a CEO, of someone that has to make an investment decision, is the industrial policy we're putting forward going to support an investment case? And I think that's the critical question. Incentives can be part of that, but it's not the only thing. And I think that relates back to the much broader conversation in Brussels around how do we actually make Europe competitive? And that means looking at, you mentioned it, quoting our paper, issues around regulatory requirements, and how do you ensure ultimately that someone has the kind of stability that they need to make sure that ultimately they decide to invest. So if the objective partially is to increase production in Europe, what actually means how do we enable that? And it's not something you can just mandate, unfortunately, given the complexity of the supply chains, but also the reality of business investment. I'll stop there maybe, and I think that gives you a bit of a sense of where we stand.
So much, Thibaut, and this is actually a very good segue to Enrico, because Enrico leads a platform based in Sweden called Platinea, which is a best practice in stakeholder collaboration. It is a platform, as I'm sure he can tell us much better than I can, working on antimicrobial resistance, already mentioned at the outset among measures of common interest. And my question to you, Enrico, would be, in the light of what you have heard so far, but especially from Thibaut, I mean, how do you address the supply chain vulnerabilities in the approach that you are pursuing? And what types of recommendations one could draw for the CMA and its implementation?
Thank you for the opportunity. Can you hear me? Sure, perfect. Well, Platinea is a platform which includes 4 different sectors. It's academia, which I represent from Uppsala University, then it's industry, it's healthcare, and it's also public authorities. And since 2017, we've been addressing exactly this kind of issues, specifically for antibiotics, and a small country, which doesn't represent the most attractive market for most pharmaceutical companies. Antibiotics are, 50 of them are in the critical medicines list. So definitely there is a lot of aspect that we can see that match what the analysis that has been made by DG SANTE and the work behind it. We identified eventually 10 options, and many of these match the proposals that are in the Critical Medicines Act. I would like to stress that we did an even step further, identifying what we call the real root causes of the problem, and that those have to do with the lack or very limited profitability for off-patent generic antibiotics. This might not be the same for other drugs in the critical medicines list, but definitely that's specific for antibiotic, which causes 3 potential problems: not only shortages, but also withdrawals and lack of registration. So the 10 proposals that we identified, they try to address these 3 elements of lack of access. And next to the lack of very limited profitability, the other problem is the lack of coordination and transparency concerning the supply chain. So, and in that sense, we know that information is somewhere. It's maybe inside a authority, inside an IT system, such as the European Medicine Verification System, but it's not used to identify, for instance, which are the criticalities in the global supply network for a particular medicine. So for instance, for antibiotics, all of a sudden the world was hit by a global shortage because a factory in China exploded, and that was Piptazo, and it turned out that was the only factory producing that API. If we were able to do this mapping for the 50 antibiotics or the 270 medicines in the Critical Medicines Act list, then we will be able to act proactively to choose the right solutions for the specific medicines. And the Critical Medicine Act identifies several of these solutions, but we need to do a case-by-case analysis. And maybe for some of these medicines, you need to use 2 or 3 of these alternatives. For instance, it might not make sense to have a single point of production in Europe when you are still dependent for intermediates on the global market. And actually for antibiotics, it's even worse, the dependence on the intermediates, which is the step before the API. And then we are 80% dependent on Asia. So you really need to make that analysis. And back to the the key real, let's call them root causes. When you do not have predictability for suppliers, then you enter into another problem. Small markets, unpredictable, then it's really the kind of situation you don't want to have. So within Platinea, we also propose a particular tool, which we call a fixed yearly revenue guarantee. And that could be something that could be combined with, for instance, joint procurement, and also having always at least a couple of suppliers, what we call parallel sourcing. These are basic ideas in supply management.
And this is extremely an extremely important insight with regards to the complexity of supply chains, attempts to disentangle those, monitor them in real time, and arrive at decisions, also investment decisions, in the light of what we learn from it. I can see a question here in the room. I'm also looking at the online audience, and Francesca, I can see you are online. If you want to come in at any point in time, I'm sure we can make it happen, even though we are in the webinar mode. So I hope technically it's possible, but please let's take the question.
Hello, thank you. My name is Marilena Vrana, and I'm representing the Plasma Protein Therapeutics Association as well. I would like to thank you all for your input so far and the presentations. It was a very interesting discussion. indeed, the act, as Mr. Bruno said, it is an intriguing toolbox, opening up a lot of possibilities in the supply chain. However, I would also like to support the observation that the supply chain fragility and the root causes of that can be a little bit opaque, because the groups of medicines are very different. The list is very large, and therefore the root causes are significantly different. So in particular, in our class of medicines, plasma-derived medicines, our manufacturing is highly dependent on not an API that can be manufactured, but on a human substance that can only be collected. And for that, the EU is highly dependent on US plasma collections. And within the European Union, the larger EU is also highly dependent on 4 member states where our sector coexists and collects plasma alongside the public and non-profit sector. So there's a significant difference in terms of root causes that we really need to look at. However, in terms of manufacturing, here in the EU, we are fortunate that we have, our supply chain is highly specialized. We do have highly specialized manufacturing facilities, many of them placed in Europe, and very strong industrial expertise and infrastructure in place. All that is needed to bolster manufacturing is stepping up collection. So my question comes to the strategic projects that are foreseen. Could these, are these projects, can these projects be seen as complementing also the calls from the SOHO regulation towards the member states to improve collection of human substances that are critical for manufacturing of medicines? Thank you.
Great, thank you very much. So Bruno, you are in the hot seat today, clearly, and as anticipated. But all the panelists are also more than welcome to respond. And I would then like to come back to the mapping issue that Enrico raised.
May not have a precise answer to your question, but what I can say is first that the legislation on SOHOs is also within the unit. So as you can imagine, the cooperation and this say exchange of information and solutions works actively also between the people in charge of shortages and the CMA and the SOHO people. So I think I would only encourage you to raise the concern or question you have today to these people working on SOHO, and I'm sure that there will be some good listening and good cooperation on these aspects, because indeed they should be, I mean, some SOHOs are probably part of the list, but it is not forgotten. That's what I want to say. Just again, this work starts, I would say. Of course, we have a proposal, but it's important that if you think that a sector, a type of product is not sufficiently, let's say, looked after or represented, it's time to raise your voice. And of course, we are here also to, as today, to listen and to take this into account when working on the proposal.
Thank you. Would anyone like to comment on the mapping point that Enrico made, particularly in the context of what Francesca Colombo mentioned earlier, namely the discussion that has already taken place in the Alliance on creating a platform? I think the case for mapping is very strong. The question remains with respect to what type of data can we get, how transparent things can be at the end of the day. I think, Gloria, you spoke about a certain degree of opaqueness that we struggle with. So can a mapping exercise be a solution to the opaqueness which often prevails?
I may start on this. Indeed, the data will be key, and they exist. They are not always accessible. And as I said earlier, we have really, through the pharma reform, the objective or the ambition to get as much data as necessary. That means a very broad range of data through these shortage prevention plans, which will allow for this further analysis. There is also this monitoring platform put in place by the agency, DMA, which will build on this data. There is also the question of the use of the verification system. Here, I would say we try to deal it at technical level because this system has not been built for track and trace. So it's really probably not sufficient, but there are people working in DMA together with the EMVO people to try to see how we could use such data or they could feed into the system. Again, we don't want to duplicate, so we want to have a system that works. The monitoring platform has been launched end of last year. It has to be, of course, further developed. But again, we will very much rely on the data. We want some obligations there, some mandatory requirements. That's the only way we can progress. And I think, again, that's at the core of the discussions in Council, where some would like a broader scope, some a very limited one, and we need the data, obviously.
Yep. Thank you very much. I would want to come back to the context that was sketched out at the beginning, the differentiation between dealing with a crisis situation and longer term systemic approaches, because whenever you think of monitoring or mapping, that distinction also needs to be made, right? It's one thing is the monitoring of shortages at a given point in time, and something else is building an investment case, right, for the longer term. I saw Thibaut and Gloria.
I mean, just to build on your point, I think you alluded to it. I think it's the question of what data exactly are we looking for, and from an industry perspective, that is critical because there is a lot of data that can be collected. There's a lot of data that can be reported. And if I link this back to the broader Brussels conversation at the moment around simplification, around reporting requirements and other policy field, I think we also need to make sure we kind of learn from that conversation as well. I mean, I'm kind of stating the obvious, but I think it's important ultimately because you alluded already to some mechanisms that exist. And so how do we make sure ultimately that we're not just feeding information to different bodies that don't necessarily interact well with each other or are asking something that's kind of similar but not in the same way, and that leads to basically ultimately a lot of time that's being spent on collection, inputting, and then ultimately not really achieving, I think, the objectives that we're trying to reach there. So it's finding that balance that will be critical, and I think the more precise you can be, the more you define the roles of the different agencies, and the more you think about who is actually doing this and how can they do this is critical to make it a success.
I sympathize with the both of you because I understand that for companies sometimes the reporting burden is immense, and well, sometimes I witness the different reporting requirements, different legislations. I'm thinking like, but then on the other hand, I sympathize with the Commission also about how difficult it is to integrate systems. Like really, this should not be underestimated, to make systems interoperable, but also, I mean, to keep a tab on where in which legislations there are reporting requirements, who you report to, how the different units will interact. So I really do sympathize with the Commission here too, from an executive point of view. Then on the supply chain mapping, I don't think we should be too careful, honestly. Like I saw that the US government is doing a supply chain mapping right now, and the level of detail that they are requiring of, I think, all manufacturers it is, I mean, it's immense. And they do this from a security point of view. So it's all in the Defense Production Act, which we are lacking. So we don't have a similar tool. I was very glad to see that in the Critical Medicines Act, there is an obligation to provide information when it is required. And I do think that supply chain information should be gathered in a structural manner to avoid the type of situation that Enrico described here, namely you have one factory that explodes and the ramifications are for everyone. I think it was also very clear during the pandemic that Breton had to go around Europe to map all the fill and finish capacity we had, because our fill and finish of vaccines was done in the US, which had an export ban. So I think, I mean, if there's one reporting requirement which I would not be stingy on or not be too careful on, it's supply chain mapping.
That's a great way of putting it. So reporting requirements differ, and some of them are more essential than others. And the question here is to, well, limit those which may be more superfluous and focus on the ones which are really key, right? Enrico, I can see you are nodding, but I hope that from your experience, that point can also be made.
Absolutely. Oh, sure. Yeah, sure. That's really the key point. And let's remember that in the registration files at the medical product agencies, you have register factories, but then we do not know which are the factories actually producing. And that's why we need something more substantial, like the verification system, where there is a module where you really have every factory and you know when a lot is uploaded there. So I do hope that the discussion will continue. EFIA apparently was positive. There were other stakeholders behind the EMV that didn't want to open it up. So I do hope that will be possible as a key to start the preventive work and also the,
yeah, great. Elena, thank you for your patience. We now come to the trade and international partnerships dimension, and international partnerships are, of course, a key part of the Critical Medicines Act. The aim is to, and I want to quote, diversify sourcing of critical medicinal products, their active substances, and key inputs to increase the security of supply in the Union. Now, the question to you would be, do you see this approach being implemented in a domain-specific way, or do you see trade instruments being used? I think Thibaut already asked you about the trade facilitation option here, and can this approach be also integrated in the ongoing trade negotiations that the EU currently has and plans in the future?
Thank you, Paweł. I think it's a bit too early to discuss how the possible international partnerships would work under the Critical Medicines Act proposal. We have to see how the proposal would evolve throughout adoption, etc. What I can say that we've worked very closely and very fruitfully with DG SANTE, and we will continue doing so. What I can also say is that we are definitely of the view, the Commission is of the view that in this increasingly insecure and volatile world, trade is a pro-security factor, and that through increasing or deepening international engagement, international partnerships, we can help make our supply chains more resilient. We can help secure access to critical input. We can help open up markets for export so that we provide opportunities for growth to our businesses that are so essential for us. But we also have tools to address security concerns as these are arising more and more, and these tools cover a wide range of instruments that we're also trying to actually strengthen, such as export controls. You know, we do not export anything. Control of FDI investment. We are controlling what is being purchased in Europe because we do not want key facilities, including in healthcare, health production, medicine production, go into, let's say, unreliable hands. We are also doing some work on the control of outbound investment. So EU investment that shouldn't, we're still at the point of mapping, but the idea is that our investment outside should not go into strengthening, again, potential unreliable partners' capacities that can be used against us. So there's a whole panoply of tools and diversification of sourcing, of export markets is a key parameter of this. And that's why you've probably heard and seen, it's a lot in the press, in this context especially, that we are stepping up even more, if possible, our trade negotiation agenda. So we are negotiating, you know, now with India, Indonesia, Malaysia, Philippines, Thailand, starting negotiations with the United Arab Emirates, hoping to ratify the concluded negotiations with the Mercosur. And we are continuing key engagement with the US and hoping for a balanced and mutually beneficial negotiated outcome to address a major economic but also security concern if these tariffs are expanded, if they strike the pharma sector. You know that there is an ongoing investigation. It's so-called Section 232 of the US Trade Expansion Act into pharmaceuticals. So the US, it started at the beginning of April. Now there's a collection of comments ongoing until, I think, early May. And we really do not agree with these investigations and hope, how to say, the tool and the concept of it, because what the US is looking at is whether imports of pharmaceuticals, but also API, derivatives, etc., into the US can pose security risks to the US. And as you know, the EU is a major exporter of medicines to the US. So we are also looking into that and engaging very closely with the EU pharma industry on both sides, generic and innovative. And maybe just to add, we are also very aware, and the Americans, that to be made clear to the Americans, if they haven't realized it by themselves by then, that European generic companies, for once, I'm just giving this example, are actually playing quite a strong role in addressing shortages in the US. And the US has more shortages than we do, and a higher dependence than we do on suppliers in Asia, especially API suppliers, intermediate suppliers. So I think that's from me for the moment, and happy to respond to questions.
Super, thank you very much. I can see Thibaut jumping already to intervene, and I'm also looking around the room as I have been from the beginning, and online for more questions and comments. Thibaut, how is that ongoing investigation affecting the broader US-European climate of collaboration and investments? And is this argument that Elena just voiced about EU-produced medicines playing an important role in addressing US shortages, is that message being heard on the other side of the pond?
The second part of your question, I think it's a bit more difficult to assess, but I think just to be very clear on tariffs, American companies in Europe, but American companies in the US have been crystal clear when it comes to the opposition to tariffs being put on Europe, and to be honest, around the world. I think that's a message that's been clear. It's been clear from AmCham EU here in Brussels repeatedly. It's been the same from our colleagues in the US. And it's true in the context of pharma and 232, but it's been the case on the other investigations. Just to address 232 specifically, indeed, the American business community doesn't support this rationale that imports into the US would pose a national security threat. And it's to some extent just one other example of. And I think we just need to recognize that the environment is incredibly difficult, that the relationship is not in a great kind of shape at the moment, but it's one area where the objectives are actually shared. I mean, you have a recognition on both sides of the Atlantic that you need to be thinking about vulnerabilities in supply chains and what that means. That's why you have that kind of ongoing work by the US government. And so the question becomes, how are we able to turn this into a positive agenda where the EU and the US can work together? Right now, Commissioner Šefčovič is engaging with his counterparts, and hopefully that will lead to, at some point, positive results. And just to connect to that, I mean, the EU-US relationship has actually been a strong and positive example of the type of international partnerships you can build in the life sciences sector when you look at the mutual recognition agreement and what that means. The idea is that this could be expanded, for example, to vaccines. And so it's to some extent, you know, just it needs to be a priority. I think the business community will continue to be very clear on that. And just to say, because you know, we tend to complain a lot. And so just to highlight, I think the full support that the Commission has for its ambitious trade agenda. I mean, that's something that as American companies invested here that use the single market as a platform to other parts of the world, it's an agenda that we fully support. And I think in these times, it's important to recognize as well the leadership that the Commission has been playing when it comes to advancing a positive trade agenda, to your point about the need to diversify. So, yeah.
Excellent. Thank you very much. I want to ask everyone about the diversification of supplies that Elena referred to, recalling an objective of the CMA. Namely, how would we go about building a strategy for this diversification, right? Because one thing is to look at the ongoing and planned trade negotiations. The one with India is one case in point. So I suppose one approach could be, well, look at what's being negotiated and use that in order to strengthen diversification. Should there be something else, namely, you know, a separate sort of standalone strategy in this field that would identify the needs, vulnerabilities, and ways of addressing them? So let me go to Gloria first, and then Elena. Yes.
Maybe you can react, because I think it's a great opportunity that we are negotiating the trade deal with India on the medicines front. I don't know for the other sectors, but because you could install a few clauses. One would be on having inspectors there for the GMP inspections, because I think in pharmaceuticals, the major trade barrier is the good manufacturing practice and the quality control. So what you would actually want is to reduce the technical barriers to trade. And so you could have cooperation there. And another part is, of course, that you would need maybe to install some kind of platform in case there is a crisis, on how you will coordinate, because this is something that was very difficult, I think, from the both sides during the pandemic. I think India had its issues regarding equal access, and I think they were very justified. And then from the EU perspective, of course, there was this export ban from India, so this made cooperation again difficult. And so it would be very useful to have some kind of dialogue in these cases, and this is something that you could do in a trade deal. Then on the other hand, I mean, so the diversification, I also have some reserves, because it sounds very good, but it's very difficult to implement in practice, also because, I mean, there are not so many pharma producing countries around the world, and for me, half of them are cancelled now. So you will, of course, want to work with, I think, Latin America, and with Japan, for instance, Switzerland, the UK. So there are a few countries I could think of, but you also need to be very strategic and not go about it in the way that we always used to, namely, trade will solve all of our problems. No, cooperation solves our problems, and preferably cooperation with the countries that want to work with you in really a clear and predictable manner. That will solve problems.
Thank you so much, Gloria. And we have a question also online, which I will try to summarize because it's a long one. But the gist of it has to do with the different standards being applied in different third countries. So basically, are the trade negotiations also a way of addressing the level playing field and standard related issue when it comes to our ties with third countries? So Elena and then Enrico, yeah.
It's a bit of a broad. Go ahead. Is it possible to maybe have a look like this to understand a bit?
Why don't you maybe say what you wanted to say, and then
Okay,
I will
okay.
let you read the question, so that we use the time as efficiently as we can.
Actually, maybe just to jump to what Gloria was saying with some good proposals. It's always good to as a member state to come forward to the Commission negotiators, because these things to really reflect on. It's not so easy to put anything in a trade agreement, and it's already very challenging to negotiate with India in principle. And then in the pharmaceutical sector, you can imagine, but the colleagues are doing all they can. But I think any good ideas are welcome. What I wanted to say is that we are not there yet. This is the situation is going on. We're working and thinking as this whole thing is evolving on international partnerships concerning the pharma sector. But something I think of is the fact that we see that free trade agreements are very big and burdensome animals. We are facing challenges to go ahead. It takes years, a lot of efforts, and we are also looking into having maybe more agile, more flexible types of engagement that's more tailor-made to specific partners. And this we have not done in the pharma sector, but we have done in 2 other sectors, and they're quite promising. So maybe we can draw some inspiration for the future to be seen. But for example, we've concluded 2 digital trade agreements with Korea and Singapore that would really help us facilitate all this digital trade environment that's increasingly all pervasive and important for our society, consumers, businesses, you name it. But also we have this, and they have binding rules, but we have also this non-binding types of strategic partnerships with a number of countries, I think like 16 countries already around the globe, a very diverse group, on critical raw materials. So, because we lack quite a few of those and we need access for our industries, critical input. So actually they're tools to get some inspiration from, and I think we'll be very creative and trying to support all these shared objectives we've been talking to. Maybe just to jump again on something that was mentioned, that resilience of supply chains is an absolutely shared concern and objective between the EU and the US, and this is part of the discussions. So I think we can hopefully meet there. And we are also aware that there's increasing discussion in the US, and there was even a recent bill, a Senate bill passed in the US Senate, a bipartisan bill to provide the authority to the U.S. trade representative to negotiate agreements, pharmaceutical agreements to strengthen supply chain resilience. So we are facing the same issues. And maybe I can read the question.
Yes, please read the question. It basically has to do with the different standards being applied in third countries, but Elena, I will have a much better grasp of it. Enrico, did you want to come in on this? Yeah.
Coming on the issue of diversity of supply, it's still relevant.
It's very relevant, yes.
Yeah, well, first an academic approach to the issue, and then something more practical.
Yep.
I will not enter into issue of specific countries, but yeah, really the ideal aspect from any customer would be to have a variety set of alternatives, and it's important that
You have to change the microphone because we are getting messages that it's not working properly.
Yeah,
online audience.
Recapping, you might have a fantastic tool to increase the purchasing power and like the joint procurement, but you might end up in a situation where you eventually only buy from one single supplier, putting the other out of business, where they could each one deliver a single country. So it would be important to have a form of purchasing that also includes not only multiple purchasing, multiple sourcing at the first level, the MEH, but also at the contract manufacturing. Otherwise, you would have 4 suppliers that rely on the same node upstream, and even the geographic distribution of these nodes. That could be part of this approach to have a embedded variety in supply. Not sure how much requirements you can put, such as one country in Europe and one outside of Europe. Then it's a matter of details. But from a theoretical idea to the concrete, I think there can be a link there.
Great, thank you very much. We're slowly coming to the end of the discussion. We still have a few minutes left, and I will want to warn the panelists that I would like to ask you for some concluding remarks. And Elena, then you can answer the question also that you have now read and digested. But maybe there are more questions coming from the audience in the room. I think what you pointed out, Enrico, is very valid, and it sort of demonstrates how one should remain on alert with respect to all the tools in the toolbox. Namely, there's no silver bullet solution. Joint procurement needs to be looked at also from the perspective of whom you are buying from, and whether or not it builds new dependencies in the process. And now we have a question in the back, I understand. Yeah, please.
Yes. Hi, good morning, everyone. I can be very short. My name is Fleur Diepstraat, and I work for a Social Democrat, a Europarliamentarian from the Netherlands. I have 3 very short questions. One is to the Commission. There is a threshold of 8 member states for the most reinforced joint procurement options, and I was curious why 8? And the reason why is that, do you think there is enough appetite from the member states' perspective to actually use it? I mean, I come from the nuclear medicines sector, and we tried a lot with Pallas, and it didn't work out. So I'm just curious, why do you think it's different now? So that's question 1. And the second one, it's a bit of a brainstorm, but the scope you choose is the critical medicines list. But we hear industry and scholars coming to us. It's not always the problem for the medicine. When we talk about access to patients, it's actually about there was no doctor being able to give the treatment in specific parts of Europe. There was no research institutes, therefore also no facilities to actually in the hospitals for the most innovative medicines. So I was curious, when we think about this European approach of access to patients, of this solidarity between us, is it all only about medicines, or is it more about infrastructures and other types of part of the value chain to make sure that we have this European approach? Thank you.
Thank you so much. I mean, I can answer from the perspective of the EPC as the organizer that we definitely have a holistic overview, and in the work that Elizabeth leads, we take all these dimensions into account. Today's event is focused on the Critical Medicines Act, given that it has just been proposed and given its importance. But this is not to say that we are disregarding the broader health context. So that's to your second question. On the first question, I let Bruno answer, and then we will go into concluding remarks.
Well, maybe on the second one, that's obviously also a very member states prerogative and competence. So I think, of course, we can help, support, facilitate as a EU institution, but these remain the organization of the healthcare system is, of course, mostly a national competence. 8 member states, I think it stems from the enhanced cooperation numbers to be checked, but I'm not a legal officer or lawyer. But and then about the appetite from member states to, let's say, group their efforts. We try to, again, have different levels of cooperation, enhanced cooperation, and for that, put some thresholds so that it's really, again, commensurate to the resources you can put in the effort. So it's really because this kind of joint procurement, whatever, will mean also some work and some resources put behind it. So we have to be selective and again focus on the real priorities. So I think that's the spirit of it. Details will, of course, obviously be discussed further. No, and if I have to conclude, then I would say we try as Commission to add another piece to the puzzle. As you know, the pharma negotiation is for us key, and it has to, let's say, be concluded soon because it's a major part of the puzzle. And with the CMA, we add another one which will build on the pharma reform, so they will advance probably in parallel, but that's a call for all stakeholders and of course negotiators to come to, let's say, positive conclusion.
I have no big concluding remarks, except that there's a lot of work to do. That we will work very vigilantly to make the act as powerful as possible. I would say that we hope that in the next MFF there will be a line on critical medicines, and that there will also be more reflection on security and defense at large, meaning that to us, medicines, it's about healthcare. It's also it's about basic needs of people, but it's also about Europe's security at large. And so this needs more reflection.
Yep, thank you very much also for stressing that, because we are holding this event also under the umbrella of the economic security and open economic security, right? That's to stress. So this is a concept which implies that we want to solve existing issues through, well, growing our own capacity, but also through open engagement and finding the right balance, which I sense will be the key question in the implementation of the act. Thibaut.
Yeah, no, I think that's a good point. I mean, you can count on the support of American companies in Europe in delivering on the objective of ultimately ensuring patients access those medicines in Europe, but also globally. I think that's critical. That's critical too. I think as we reflect on the act, I'd be cautious about the localization requirements that are in there, because I do think this will lead to a disruption of supply chains and may not necessarily lead to what ultimately was intended. And so I think that's where the conversation will be critical as both the Parliament and the member states, get this through the finish line.
Well,
yeah, conclusion about the broader picture from my side, and we're talking about improving resilience, right? And in a recent analysis we made of the Swedish supply chains for antibiotics, we identified 3 ways in which policy can do this. One has to do with multiplying the supply chains in terms of nodes and this variety aspect. Then there is the element of gathering supply chains as an option, which makes them easier to control, also from the perspective of the public buyer. But the third element is reinforcing the supply chains, which has to do with improving the relationships between the actors, starting from the public buyers, MAH, all the way to API. And that requires also bringing more resources into the chains, such as new payment systems, better collaboration and communication. If we use these 3 mechanisms, which sounds very conceptual, but then you can see how they connect to different policies, I think we can make good steps in that direction. Thank you.
Wonderful. We certainly have to be conceptually cohesive here. Elena.
Thank you. Maybe just one line to say that I fully echo what Gloria just said, that you cannot have, we need to have a functioning pharmaceutical sector and access to medicines available, access to available medicines as part of security. Just otherwise, it's probably civil war or everything falls through. And I think there's increasing awareness that this sector is absolutely strategic. And I think you probably saw that the Commissioner President von der Leyen organized a high-level strategic dialogue with the pharmaceutical sector, the whole industry, generic and innovative, called in a lot of chief executives on the 8th of April. So there's a lot of follow-up coming on from these discussions, and I think that's a great thing. I think it's not for me. Maybe that was just a quick question, a quick reply on a question. It's a very, very valid question, and I know it addresses very deep and real concerns and justified concerns of the pharma industry, generic industry, I think in this case, but it's actually for other industry as well, of what we are going to do or what we are doing about some imports of some partners, some big partners, trading partners that do not comply with our environmental standards, labor standards, etc., you name it, and then can undercut costs and, you know, damage competitiveness of our own industry. It's a real issue. I don't think we have the tools at the moment to tackle this, but I think it's really part of the reflection, growing awareness, and part of the reflection, big reflection going on now at the EU level, and we're looking into it.
Great, thank you so much. Now, before I thank all the speakers, I would like to invite Victor Mendonça from Viatris. Thank you for the collaboration, and please also share your observations as you were listening to the panel.
Thank you. Just a quick word, mainly to thank the speakers for coming, and I think it was a great discussion and to get all these insights. So thank you all of you for joining. We as a company, and we are proud to sponsor this debate because we are very focused on the access dimension, right? And we have manufacturing facilities in Europe, but we also have them around the world, 40 manufacturing facilities around the world, 10 in Europe. So we really see this from a global perspective. We also have generic medicines, on patent innovation. So we also look at this not only from one side, but try to get a global view on these dimensions. And we are proud to say that we serve 1 billion patients around the world. So to the WHO point, right? We think about our footprint globally and the value that we provide to patients around the globe. And maybe just two very quick comments. Indeed, when or maybe three. The first one would be to say that the process that was established by the Commission, Critical Medicines Alliance, the dialogue, and the Critical Medicines Act is very positive, opening the opportunity for dialogue among all stakeholders, and everyone has the chance to share their views. And this, I think, will lead to better outcome in terms of the policies and the recommendations as everyone is able to share that. And the initial objective was indeed to solve the issue of shortages. And this has to do with patient access, right? And I think it moved away in the dialogue, or enlarged, maybe it's a better word, also to the element of the strategic autonomy, right? And the two things might not be exactly the same, right? When we are trying to address patient access and try to reinforce or try to reinforce the resilience of supply chains and try to avoid shortages, we need one set of measures that have to do with the market dynamics, with the regulatory dimensions, and so on. And when we think about Europe's strategic autonomy, other measures are needed, and they might be in conflict, right? If we think about prioritizing EU manufacturing in procurement, this might reinforce strategic autonomy, but might not reinforce the resilience of supply chains or better patient access. So I think this needs to be considered going forward. And the last point, I think, has to do with the dialogue with the European Commission and member states. This is very much welcome. And I think it's something that we have seen along the years not being fully coordinated, or member states taking measures that are not fully aligned with what's happening at the European level. Maybe in a simplified version, Europe and European Commission doing the regulation, but then at the country level managing the budget and the market measures, and they might not be totally aligned, right? As regulation typically adds cost, and also the objectives at the country level are usually to manage budget, which might be in conflict with that dimension. And when we think about these two dimensions, and now we are also discussing other files like the Urban Wastewater Treatment Directive, that will come with a massive bill, and this element alone, if not properly coordinated with the member states and the market measures, might have a much bigger impact on patient access to medicines than that everything that we have discussed here, including tariffs and other elements. So that dialogue and finding the right market incentives, country incentives, to make sure that when the regulations come, they also work and the companies have the capacity to comply with those regulations, but at the same time preserve patient access. So thank you again very much for all the insights, and for EPC for leading and coordinating the event.
Great. Thank you very much, Victor, for making these important points. From my side, a very warm thank you to all the panelists for a thorough, interesting, and I would say very forward-oriented as well discussion. And I would now like to give the floor back to my great colleague Elizabeth, who will draw conclusions from the whole morning and tell us what's next on the EPC side.
Well, thank you very much, Paweł, and thanks to everyone, because frankly, this was a very stimulating discussion. I think it was very intellectually stimulating, but as you say, also very much forward-looking. And I think especially from, a policy-making perspective, there is a lot indeed to digest when it comes to our follow-up publication that indeed we plan as a next step to this event. And I think it's very clear that we heard this morning that the emerging doctrine of open economic security is an important yardstick to address the needs of healthcare resilience. And clearly also indeed making the link, and I think you reiterated that, Gloria, but we have written that as well from the EPC perspective, by ensuring that indeed health is also part of the defense and security narrative that we're developing currently. In essence, really, it aims at an equilibrium between a vibrant domestic manufacturing capacity, measures to prevent risk in the supply chain, and active engagement in building international partnerships. I think that was another motto that really came across very clearly, basically, from all speakers. Its open nature means that it builds on the value added of international trade and cooperation, while reducing excessive exposures, which can be easily become critical vulnerabilities in time of crisis. And I think that was very interesting that in the discussion this morning, indeed, the times of crisis were being reflected against the routine measures that we also need in the current context. So the implementation of the Critical Medicines Act should follow this logic. And now is indeed the time, Bruno, as you say, indeed, where it's important that we listen to all these arguments being raised, because this logic should be followed by placing equal emphasis on providing strong incentives for investment in manufacturing capacity within the EU and enabling collaborative procurement across the EU. And I think there, as you said, Bruno, a lot is dependent on the political will of member states, but it is important that we now formally have these regulations as part of the Critical Medicines Act. And we also should indeed be actively pursuing international strategic partnerships for the sourcing of critical medicines and other ingredients. So our publication will be built around the 3 Ps of Europe's economic security, and also building on the work that we now have been doing for more than 2 years. Where indeed the Commission has been coming up with the 3 Ps, which are promote, protect, and partner, and where we as EPC have always been stressing the importance of another P, which is about preparedness. And I think indeed that resonated quite well in the discussion this morning. So there will be several crucial issues, and again, I'm aware of time and the nice weather waiting for you, so I will not be too extensive, but I think we will indeed be focusing on strengthening pharmaceutical supply chains through joined up approaches between EU as well as national policies, where we then will stress the importance of interconnected global supply chains and ways of achieving economic security through fostering innovation, investment, and collaboration across borders. Another issue which I think is very important, and especially in healthcare, which tend to be sometimes quite scattered given the limited power at EU level, is, as also Lorena Alonso stressed in her opening remarks, the alignment between the Critical Medicines Act and other initiatives. And several of them were being mentioned. Think about the Competitiveness Fund, the Europe Economic Security Strategy, but also the ongoing pharma negotiations, as well as the broader context of the European Health Union. I think another point which is really important and links to the broader discussions that also we have had in the EPC is ensure that the Critical Medicines Act attracts biomanufacturing investment in the EU and ensure the scale and speed of innovation, as Mario Draghi has also pointed out. And again, exploring the role of international partnership was mentioned explicitly and very often, so we will indeed also illustrate it in our upcoming publication. So I think these were just a few elements, I think, that stuck to me when I was trying to make notes and keeping pace with the speed of the discussion, and I think the arguments that were being exchanged. So I would really like to thank all of you for coming here today. I really, again, would like to thank our panelists, and not in the least also Paweł for your inspiring moderation. I would like to thank, of course, our colleagues from Viatris for their support, and also my colleague Sam, you're being very modest here on the first row, but also for your support these past weeks in putting together this event. And as I always say at the very end, please do follow us, because we have been doing a lot of work on economic security. But on the 5th and the 6th of June, so basically in 1.5 months' time now, we will have the Brussels Economic Security Forum, which I think is the culmination of all the work that we've been doing. And it's indeed led by Paweł, but also including colleagues like myself and others to ensure indeed that economic security is being addressed from a very broad perspective, and many sectors, among them pharmaceuticals, will of course figure in these 2 days that we will dedicate to economic security. So with that, thank you again, enjoy the nice weather, and hope to see you next time. Thank you.